Good day everyone, and for today's video is I'm going to perform the return demonstration on the MDI or the meter dose inhaler. This is a small portable aerosol dispensing device. So for the equipment of this return demonstration, we have the meter dose inhaler and the spacer. So first thing is to verify the physician's order and review of the patient's chart. Gather all the required equipment, check all the ensure that medications are available and expiration dates are current. So provide privacy and wash hands. Hand washing deters the spread of microorganism. We have also identified a patient, and my patient for today is Mr. Vinluan. So, hello Sir Vinluan. I am your respiratory intern for today from San Pedro College. I am J.U. Pantaleon. And I'm going to perform the return demonstration on meter dose inhaler. I will give you the meter dose inhaler, sir. And an explanation of the procedure relieves anxiety about the procedure. Next is to place the patient into a comfortable sitting position or the semi-Fowler's position. A diaphragmatic expansion and lunge compliance are greater in this position. This measures the maximal effectiveness of medication in the basilar areas of the lungs. So assess the patient, auscultate the chest, and measure the heart rate and respiratory rate, and measure the peak expirometry flow as indicated, and obtain the baseline data of the note or normal breath sounds or findings. So, auscultate sila to ang chest, sir. Inhale. Exhale. Inhale. Exhale. So, basically, normal towel tourniquet and crackles. Next is attach the mouthpiece to the canister and remove the cap from the mouthpiece. Then, if a spacer is used, then attach the spacer device to the MDI. So, meter dose inhaler to ensure that the aerosol can pass through the spacer without obstruction. So, the spacer devices help to slow the velocity of aerosol particles, enhance the vaporization of the propellant, and require to obtain optimal result. So, shake thoroughly and prime the MDI before use. It is done to mix drug and the propellant, which can separate in the canister over time. Priming is required to provide an adequate dose according to the manufacturer's guidelines. Then have the patient hold the MDI a few centimeters from the open mouth and instruct the patient to inhale slowly and deeply while activating the MDI by squeezing it. Then, instruct the patient to continue to exhale and hold the breath in the end of the exhalation for 10 seconds. Then, to allow the proper deposition of medication to smaller airways. So, then have the patient slowly exhales following medication administration. Then repeat the procedure as many times as ordered by the patient's physician, waiting between puffs. So, there is a reassessment of the patient after the procedure, the patient's heart and respiratory rates following medication administration, auscultate the chest, measure the peak expiratory flow, and the following aerosol administration. This is to note the changes in breath sounds and evaluate the effectiveness of the therapy. So, auscultate na to ato ang chest, ma'am and sir. Inhale. Then, exhale. Inhale. Then, exhale. So, normal. Then, give health teachings regarding the medication. For corticosteroids, we have to instruct to rinse mouth after every puff to prevent oral candidiasis. So, do aftercare of the equipment and wash hands. Hand washing deters the spread of microorganisms. Then, we should always document the time of the therapy, medication use, and patient's response to therapy. Note the tolerance of the treatment. A written summary provide an accurate documentation of the care and the patient's response to the treatment. And once again, thank you so much, Sir Vin Luan, for your cooperation. And that is our metered dose inhaler. Thank you so much.